All right, everyone, welcome. Thank you so much for joining us today. My name is Becca Melnick. I am the Associate Director of Admissions here at the Yale School of Public Health. I'm joined by Rafael Perez Escamilla, who is a professor of social and behavioral sciences and the director of the Global Health Concentration, as well as Anjuli Bodick, who's the assistant director of the Global Health Concentration. And today they are joining us to speak more about global health at Yale and about the concentration. A few kind of housekeeping things as I turn over to Rafael to share the slides. We are recording this session today and the recordings will be posted online. So just keep that in mind. If you choose to participate, it will be kind of included in the posting. And we do encourage your participation. We want this to be helpful for you as you learn more about the school and the program. So please ask any questions you have. Feel free to either use the raise hands feature. We can call on you for your microphone and video, or use the chat, either one. As hopefully you've all seen, we have a whole series of events for the next week or so with departmental programs next week, and we encourage you to join us for those as well. If you have any questions about the events, they're on the website, and any questions for us in admissions, we're always happy to help. So with that, I will turn it over to you both to speak more about global health.
Thank you very much. And I am opening the PowerPoint right now. And Julie, did you send me the latest one?
Yeah, I just sent it to you just a few minutes.
Okay. Yeah, so just let me open it. Just give me 1 sec, please. Okay. So, okay, here it is. Very good. Thank you, Julie.
You're welcome.
Okay.
Is it the latest one?
Yes, it looks like. Yeah. So let me share my screen first. That way we can. Okay.
Great.
Okay. Can everyone see my screen?
Looks good.
Okay. So welcome everyone to the Yale Open House for admitted students for the best School of Public Health in the world. I am very happy that you're all thinking about joining us soon. I know what it takes for you to have been offered to come to the school. And one of my favorite things is to share with you what I think is one of the most exciting concentrations that we have. The core team for this concentration is myself as director and instructor of the required foundations course, Michael Skonieczny, who is responsible for coordinating the required global health seminar, and Christina Talbert-Slagle, who is a lecturer for the wonderful global health capstone course. And Julie is our wonderful assistant director, who not only help us coordinate the academic aspects, but is also great at preparing really fun activities and also at sharing very, very good information for you all throughout your 2 years with us in the school. So with regards to the operational definition that we follow for global health is first and foremost the field of public health that focuses on public health challenges that transcend nations' borders. In other words, we know that the Ebola or COVID-19 viruses do not recognize borders, do not say, oh, I cannot get into this country, I'm not going to cross. We know that these are pandemics that affect all the world that require global responses for them to be contained. And the same could be said about the pandemics of obesity and non-communicable diseases such as type 2 diabetes, cardiovascular disease, some types of cancers, etc. We know the opioids epidemic, many of the substance abuse and mental health issues that crisis that the world, that countries are facing are truly global in nature as well. And the gun violence epidemic that we are going through and have gone through for many years in the US is not unique to our country. And in many instances, they have very common causes and also common solutions. In the global health concentration, we emphasize that we're not only here to be doing research and publishing papers, but also to train all of you on ways to improve your practice learning and your practice skills that you are going to need to, at the end of the day, deliver a very powerful interventions or programs that take into account the fundamental principle of equity in health for all people globally. So the global health concentration is available to students in any department from the following programs. A 2-year MPH program. I know many of you have probably enrolled in the 2-year traditional program. It's also available for the 5 years Yale College students program, and also for the AP MPH program, which is done by advanced professionals or medical students, and it's done in 1 year instead of 2. So it is available to all of you falling in these categories. We emphasize integrated problem solving, again, through an equity, through a social justice lens. And at the end of the day, we want for all of you to graduate from the program, learning ways to not only describe, but also be very analytical on how you examine global health issues. Global health issues need to be communicated in a particular way, following different terminologies to different audiences. Sometimes we're talking to policymakers, sometimes we're talking to journalists, sometimes we're talking to advocates, sometimes we're talking to international development organizations. And it is very important that we need to communicate clearly with each of those audiences on not only what are the causes, but which are potential cost-effective solutions for global health problems. And I will now turn the presentation to you and Julie. If you can please take us through the global health concentration course requirements, I would deeply appreciate it. And I will do the slides for you.
Thank you. Welcome, everybody. My name is Anjali, and I wanted to talk with you a little bit about the curriculum. So your first course that we have in the sequence is the Global Health Seminar. And as Rafael mentioned earlier, Mike Shkonechny is the course instructor for that. And it's a great course where they talk a lot about different hot topics in global health research that's going on, different projects, practice as well. And that's held in the first semester in the fall. So if you're interested in participating in the Global Health Concentration, I highly recommend that you register for that course in your first term. And then in your second term, we have our new Foundations of Global Health course, which we'll talk a little bit more about in a minute, which is taken in your second term in the spring, and that's a 1-credit course. And then in between your first and second year, you have the internship, and also the internship will meet the guidelines for the Office of Public Health Practice, which I'm sure you'll hear from at some point coming in the week. And that's conducted, like I said, over the summer. So typically students for the Global Health Concentration can complete an internship that's in a low to middle income country. Obviously, right now we're dealing with COVID, so we've been doing a lot of remote work, which has been going really well for students, and they're finding that even though they're not in country directly, that they're learning a lot, making meaningful relationships, and contributing to projects around the world. Here as well, domestically, we have a lot of projects going on. And then The last component besides your electives is your final semester in the spring. You'll take the capstone course, which is evidence-based decision-making in global health. And this is a course, it's not like a practicum capstone, which some of them are. You'll also be taking 3 electives from at least 2 perspectives in global health. So we have 6 perspectives. Some of them are epidemiology, history, social behavioral, psychosocial, implementation science, policy, development. So those are just a few of them. So you want to take at least your 2 of your 3 electives for different perspectives in global health, for the reason just to do that, give you a different perspective. So whether or not you want to be an epidemiologist, but you might also look from the psychosocial perspective as well. And we have a list of pre-approved courses that has all the electives. You can see right down there. And if you have courses that you'd like to be approved and they're not already, we have a mechanism for that. So Rafael, if you want to go to the next slide and talk about YIGH.
Yeah, so within Yale, we established a couple of years ago the Yale Institute for Global Health, and Mike Skonieczny is in fact the executive director of that institute. The faculty director is Professor Saad Omer. And this is an institute that is led by the Yale Schools of Public Health, Nursing, and Medicine. And it is a university-wide program that actually serves as a center for the development and support of research and education and training activities. So we mention this because our global health concentration is very, very well integrated with YIGH, in the sense that we constantly bring to your attention opportunities for the Sustainable Health Initiative, for internship programs, and actually even to do some work with the Yale Institute for Global Health. And we do want to encourage you all to visit their website so that you can see some of the work that the Yale Institute of Global Health Fellows do, and also some of the Sustainable Health Initiative activities that they are pursuing. And Julie, please.
So our program is a little bit different. We don't have a formal approval or denial. We have an open enrollment. And what we're doing is using an online platform called Campus Groups, which you might be familiar with already, because I think that might be how they're doing this program. If not, you will become familiar with it if you join Yale. It's a really great platform. So what we do is we ask students that are interested in pursuing the global health concentration to join our Campus Groups page, and we have a form on there that you complete. And the purpose of it is to submit your intentions that you want to complete the requirements. And that way I'm able to help track you, myself with Rafael and our faculty advisory committee, and meet with you regularly to make sure that you're meeting all of the requirements for the concentration, helping to choose courses, internships, looking at prospective jobs. And then also, like Rafael mentioned earlier, we try to have some fun social events as well. So that is how you enroll in the concentration. There isn't, like I said, an approval or denial process. We, for COVID reasons, have been doing everything via Zoom, but I find that students are liking it. And as the campus starts to open up, we'll do lots of in-person events, safely as course. And we will have meeting space within the office that if students prefer to meet in person, we can do that. And then for future, for further advisement than just meeting with myself, like I mentioned, our faculty advisory committee have representatives from each of the departments. Great. Should I talk a little bit about the mentoring programs?
Yes, please, and Julie.
Great. So today we actually had our kickoff for this year's mentoring program, and it's dedicated to assisting global health concentration students to navigate their academic and professional careers. So what we did today is we had 6 different panelists from different perspectives of global health. So Raphael joined us on behalf of academic research. We had clinical researcher. We had some longtime professionals in policy and development, as well as implementation science. And so what we do is we had a panel, and then we match you with a mentor based on, your needs. And it's a really great way for students to meet with practice scholars in the field that are actually doing the work and help get some additional mentoring specific to global health. Do you want to go over to the next one?
Yeah.
So the Global Health Seminar, like we mentioned earlier, is with our instructor, Mike Shkonechny, and it's about hot topics that are happening in global health right now. We bring in people from over the university as well as outside the university. We've had people such as Keith Hansen from the World Bank, also different researchers here at Yale, and we talk about new things that are happening, just to expose you to the different things that are happening in global health. And with our new foundation course, we try to make sure that these courses are working together and there's not overlap, but they're enhancing one another. So it's a really great class. And this year we did do it on Canvas, but we were able to bring some people in from other countries that were unable to join us otherwise due to travel restrictions. So this was great. This, like I said, is a recommendation. So Raphael, do you want to talk about your new course?
Yeah, so this course, it has just been approved, and I am very excited because we have totally revamped the foundations course in global health. And we will be covering both principles and applications. And the fun part is that this will be completely a case study based course, meaning that you will be learning from real world examples how and why different policies, different programs were developed, and why some ended up working more than others. We do go through the foundations of global health, especially examining the governance of global health, understanding its colonial origins and prevalent neo-colonial approaches and inequities. So if you go into CNN today or online, you will find a story of how high-income countries have done so much hoarding of vaccines that there are over 130 low-income countries where not a single person has been vaccinated. And if this situation doesn't get addressed soon, essentially, we will have to live with this pandemic for many years to come. Because as I mentioned, in global health, we all need to pull together. The issues have to be addressed globally, and they have to be addressed with equity. Otherwise, the solutions to the pandemics just don't work. So the COVID-19 is really emphasizing not only the enormous inequities within the US in terms of which are the populations that have been most affected, which are the ones that have been having less access to the vaccines, but globally, it is crystal clear that we're still living in a very neo-colonial era when it comes to global health governance. And the course is not simply to criticize, but also for all of us to think together. If we want to change this, what would it take, and how could we go about it in a constructive way so that we are at a much better place, say, a decade from now, so that the next time the next pandemic hits, because all of this is very connected to climate change, unfortunately, is going to happen again, probably within my lifetime, at least once. We want to be much better prepared and put into play the lessons that we learn. We will use a flipped classroom pedagogical approach, which essentially means that you will be seeing before the lecture the pre-taped traditional lecture, and during class time, we will be discussing, we will be debating very interesting readings that really provide a lot of food for thought and underlie the complexities that decision makers in global health face when they try to come up with reasonable solutions that, yes, they are evidence informed, but that at the same time are implementable and feasible. When we ask employers in the global health sector, what are the top priorities when it comes to what they want to see on the candidates? And we went through this exercise today with Anjuli and the wonderful guest that she brought. The number one is critical thinking. Probably number two is team science or team problem solving. And at the end of the day, the world needs team players that together can become a force to reckon with when it comes to their critical thinking and critical analysis skills that can get applied to propose solutions to global health problems. Specifically, the course is designed to provide you with the following competencies: understanding global burden of disease patterns, understanding the roles, relationships, and resources influencing global health and its infrastructure. Third, understanding the sustainable evidence-based solutions to address key global health challenges across the life course. And by understanding, we mean understand how to design, what is the process that we have to go through to achieve that very ambitious goal that requires interdisciplinary efforts. And last but not least, we do have always to be addressing all the issues on the ethics of different global health practice approaches. I don't know about you, but as far as I'm concerned, having a system in place where 95% of the vaccines in the world have been delivered to perhaps 10% of the population, either in high-income countries or high middle-income countries, to me, that's not an ethical approach to global health practice. So we will be discussing from a scholarly point of view and a practice point of view how to improve this situation. And the capstone project, which is taught by Christina Talbert, it's truly wonderful. It's an evidence-based decision-making in global health course. Christina has really now years and years of experience dealing with PEPFAR, helping Liberia rebuild a much more equitable and efficient healthcare system. And she will highlight also mainly through case studies the different types of evidence that are used or can be used, and to develop, once again, critical thinking approaches to find out clever ways of evaluating programs and coming up with the evidence that is needed in the real world by decision makers. This is the course that will also emphasize a lot the communication issues in global health with regards to causes and solutions, thinking about different audiences, and essentially you will have a whole practicum or practice session as part of the course. And that course must be taken the last semester before graduation, because after that you will no longer be here. So everybody needs to make sure that you take that course if you want to get the global health concentration on your records. So with regards to the electives, the 3 courses that need to come from at least 2 perspectives, we do have lots of them. We have 6 perspectives. I'm not going to read them. You have them in front of you, but it is very easy to find the 3 electives in any area that you want to further your training on. Anjuli has really led the charge pre-approving not only the list, but posting them on the website so that you can have at your fingertips all the electives available, and you're free to propose additional ones as she has indicated. But everything in the global health concentration has to be approved a priori. We no longer do retroactive approvals because that was creating a lot of confusion and the sense of unfairness among students. So if you want to take a different elective that is not listed because it's a new course and we were not aware of it, that's fine. but we cannot go retrospectively and say, oh, I really didn't take those 3 electives, but I took all these 3 other courses that I believe you should approve for me, but I forgot to ask permission beforehand. And then with regards to your summer internship, we expect that for the global health concentration, it needs to be conducted in a low or middle income country, although we can make exceptions, and we can go into that on the question and answers period. Sometimes it does make sense for someone that has had already a lot of practice and public health experience in low and middle income countries, perhaps to do work with immigrants in the US or with UNICEF in New York and things like that. We recommend 10 to 12 hours of full-time work. So they usually happen during the summer. And you do get a lot of guidance and support from beginning to end from the Office of Public Health Practice and the Center for, what is CMC?
Oh, the Career Management Center.
The Career Management Center. I think it was called Office of Student Affairs before, something like that. Yeah, so if you want to do a domestic internship, you will need pre-approval, and of course, you will need to explain why it is addressing a global health issue. Of course, we consider the US as part of the global community, so oftentimes, for those that have had a lot of experience abroad, it's not that hard to make the case. So essentially, that's what I just said. And can you tell us about the internship placements for 2019, and Julie, so that they see all the places in the world where our students go every summer?
Great, yes. So this is a chart from 2019. The 2020 data is a little bit different and it's still coming in. But these are the places where students have traveled in the past to conduct their internships. And some of them were in research, a small percentage of them, and a larger percentage of them were in practice organizations, so working in the field or within an organization not conducting research. So you can see that, there's a great question about if internships are paid, and some internships are paid. And if they are paid for by the organization, you aren't eligible for YSPH summer funding, but there are a lot of other funding opportunities to help students fund their travel and their time abroad. And then the internships that are not paid, which are also a large percentage of them, there are funds throughout YSPH, and like I mentioned, across the university, a lot of different funding opportunities to help you fund the travel. Mm-hmm. And then another question just popped up, but I lost it. So we'll get to it in just a minute. Thank you.
Well, someone just said that your response made sense, Angie.
Oh, okay. I thought there was another one. Oh, wait, there is one question about, are there language requirements to do certain internships? So there aren't language requirements. Students are able to choose their internships on their own with help from the global health concentration. We have some signature internships that are just one small percentage of internships that students conduct. So there aren't language requirements. There are a lot of language courses, like short courses that you can take across the university to help prepare for your time abroad. And we do recommend that you do look into some of those or prepare at some point to travel like that, but there's not a specific requirement. Mm-hmm. So speaking of preparing for travel, we have an international pre-departure preparation workshop, which is required for all students in the global health concentration, but now also all of our YSPH students that will be traveling internationally. We have some online workshops and live workshops, and they're really involved in make sure that we're doing large group discussions, role playing, we're talking case studies of things that have actually happened. Topics are including things that you want to do prepare before travel. So mental health, personal health and safety, and you can see other topics here. And like I said, we try to make sure that it's really involved and that you're not just sitting and listening, that you're going to be actually learning from cases that we've developed from past summer internships from students at Yale.
And Julie, we have a question. Okay, I'm going to read it. I'm going to read it to you.
Okay.
Since it's a requirement to go abroad, if you don't have the abroad experience already, is there significant support in finding an internship, or do students find the internships through their own research?
So it's a great question, and there is a very significant help between our office. So currently we have signature internships in a few different sites. So some of them are with Amaltash, which is in India, another organization in India, the Population Foundation of India, the New Mexico Department of Health, the BRAC University in Bangladesh, and Hands on Peru.
Mm-hmm.
And were you going to say that one, or did you say something else?
No, Hands on Peru. We're also, we have established a memorandum of understanding with the National Institute of Public Health in Mexico between YSPH and them. It's not specific to the Global Health Concentration, but definitely that's a mechanism that anyone who wants to go to Mexico can use.
Wonderful. So besides those, the Office of Career Management Center hosts a full internship database of all the past internships that students have conducted, and you can go and look and search by global health concentration or country or topic area and see what students have done in the past. So there's never been a YSPH student that hasn't had help finding an internship or finding one that they find of interest. So there's definitely a lot of help for that there.
Okay, and another question, Anjuli, what are the international opportunities for students participating in the advanced professional program?
So that's a really great question also. And the students in the AP program don't do a summer internship. So unfortunately, they're not able, because it's a one-year program, they're not able to do the internship in the summer because they're graduating. So that internship requirement is not part of their academic requirements. They are able to do a practicum, and I think that is something that's required. And for their global health track, they have to be, it needs to be focused in a global health manner, but there's just not the time availability to do travel. Let's see. May I ask what organizations or schools students have placed for the internships? That's a great question, Rosa. Thank you. So some of the organizations, I should have been a little bit better prepared for this. We've had students at UNICEF, with PEPFAR, like the signature internships that I mentioned before. With Amaltash, we've had students there many years. Rafael, do you want to mention a few organizations?
Yeah, so I think you mentioned the World Health Organization already, but I just want to tell you that I go oftentimes to, or before COVID, I would go to Geneva all the time for committee meetings. And one summer, one of my advisees was doing her internship there, and we scheduled to have lunch together at WHO. And she showed up with 5 more MPH students from Yale to the launch. Not all, of course, not all of them with a global health concentration, but really, from different departments doing different policy projects. And we've had a very, very good and long-term relationship with WHO. Also, we've had students doing work with the Food and Agriculture Organization in Rome. And, they have been working with UNICEF in many different offices in different parts of the world as well, including New York. So yeah, I'm sure I'm missing many right now, but we do have links with the major league players here, and our students end up taking advantage of those networks. We also have had very good experiences with Save the Children. As you know, they have a big office in Connecticut, and also they have offices all over the world. And we do have, professors have partnerships with universities all over the world. So a number of students also end up going to Brazil or to Mexico or to Uganda simply because of ongoing research projects, or Samoa, for example. Professor Nikki Holly has a very interesting long-term project going on in Samoa, and She oftentimes takes students to do internships, and she's a member of the Faculty Advisory Committee of the Global Health Concentration, representing the city, the chronic disease epidemiology.
So there's another question about fieldwork during the internship, and is it usually a clinical experience, or are there opportunities for other types of service?
Right. So let me take that one, Julie. So I would say that the great majority of internships end up being practice experiences. I would say most of them public health, not clinical, in the sense that they do engage, many of them, with community-based projects versus, clinical care. But it is possible also to engage with a clinical care project if it makes sense for the student. About, I don't even want to give a percent, but the minority end up actually doing research, data collection for their thesis projects. That takes a higher level of organization and access to funds, and really access to a faculty member somewhere in the world that already has a research site going on where you can add a component to it. It's very, very difficult with the time constraints for a student to build from scratch a project that is totally de novo. So that would be my response to that. Sometimes students have had issues with the local IRBs and cannot implement a research study, but they all end up having a very rich experience through practice. So, and I would say that the majority then would come back and work with a faculty member in the lab group of the faculty member, and oftentimes they are provided access to data to analyze for the projects, or they are mentored to analyze existing databases such as demographic and health surveys and so on. Would that be a fair response, Anjuli?
I think that's great.
Okay. So this is and I'm sorry, part of my screen is blocked. So, okay. So that is preparing for remote public health practice internships, which may or may not be an issue for you guys, but you can just briefly mention what we're doing, Anjuli, so that they see how quickly we adapted to what was going on to keep the wonderful training going for our students.
Absolutely. So, and when COVID hit last year and our students had already had their internships planned, we needed to make sure that we were preparing them for what they were going to be embarking on. And without being able to travel, we developed some resources and some panels and workshops for students to talk about how to prepare best for remote work. So we had a faculty experience panel where faculty from across the health profession schools talked about how to best prepare and what's most important when working with organizations remotely, such as best professional practices and skills. We talked about how do you engage and connect with your preceptors when you're not in person, how to work across time zones, ethical considerations and cross-cultural sensitivities that are important even when you're working remotely. Mm-hmm. And like I mentioned quickly earlier, the students had a really great experience still. And this year, in preparation for our students that will be conducting remote experiences, they are conducting a student panel to talk about how to make the most of your remote internship and make sure that you're really having a meaningful experience. So mm-hmm. Students, faculty, staff, everybody's coming together to make sure that the students are still having the best experience possible.
Mm-hmm. Okay, so Rosa Gonzalez and Julie, and I will take this one, is asking about which organizations or schools we have worked in Mexico. So Rosa, we have a very strong partnership with the National Institute of Public Health, which the headquarters are in Cuernavaca in the state of Morelos. They also have a campus in Mexico City, and the National Institute of Public Health is a major think tank for the Ministry of Health in Mexico. And at the same time, they host the top School of Public Health in the country. So we have not only an exchange of students type of memorandum of understanding, but for example, I'm going to be teaching in Spanish a summer course for them on applications of implementation research to public health. So we've sent a number of students there. They have actually been able to do very nice research because it's a very, very strong research organization. And we also have a very strong collaboration with Universidad Iberoamericana in Mexico City, which is my alma mater. And we are doing a ton of research. And it's also an institution that has the facilities and the ability to host our students. In fact, Grace Carroll and Julie spent like 4 months with them doing wonderful research. So those are two that come to mind right now, Rosa.
I also want to clarify, I guess, or point out, which we've kind of talked about, that you're by no means limited to the organizations that the school already has connections with. Those are great opportunities to help, get you connected with professionals and researchers in the field who are faculty and our staff and our school has a connection with, but there are no limitations to where you can do your internships, do practical work. And like has been mentioned, there's a lot of support to help you through our global health team, through the Career Management Center and the Office of Public Health Practice, and starting those relationships if they don't necessarily already exist. So you're just not, I just want to make sure everyone knows that you're not limited to kind of what's already in place. That it's really, you have a lot of
Right. And that's absolutely right. And we're very, very supportive. And we work with the students to make sure that the organizations they want to go to that we have never worked before, something that, they're going to support them. They're going to have the infrastructure for them to do their internships and all that. So we definitely are very supportive of those, making sure that you will have a good experience when you go. And if you already know them, that's it. That's you're ready to convince us within 1 second. And Julie, there is a question about those in healthcare management. Do many of them do the global health concentration, and what kind of opportunities they have for internships? She's Hallie is very interested in clinic administration or program management from a healthcare management perspective.
Absolutely. So we have a few students each class that are from healthcare management and our health policy that do the global health concentration, and they do a lot of health program management. I'm trying to think specifically about projects that we're doing right now. I can't think off the top of my head, but Becca mentioned that they have access to the link that's highlighted on your personal URL page. Becca, can you talk a little bit about that, where that link can be found to show them the past internships?
Yeah. So we don't list them all out, but there are definitely some great examples and some kind of summaries from the past years. We also have our 2019 data still up because it's more complete. But everybody should have your personal URL links. You should get emails from me somewhat regularly with links to them. And that's a great place to look at kind of examples. And if there's specific examples you're looking for, you're always welcome to reach out to the student ambassadors are a great resource. So everybody should have been in touch with a student in your department. They can help it. I find that sometimes they know what their classmates are doing better than we necessarily know every moment. So they're a great resource to talk about kind of those specific interests. And it should list also in the student ambassador directory, not only students' departments, but if they're doing a concentration. So you can see specifically within your department or program what students are also following the global health concentration to get a sense of their experience. But you're always welcome to reach out if you want kind of more specifics. We can help connect you to career services or the Office of Public Health Practice as well.
Yeah, and I would be happy, we'll give our emails at the end, but I'd be happy to talk more with you via email or on Zoom. If there's specific projects, we can talk in more detail and I can connect you with students too. We've done that a lot. And we could talk.
So thank you very much, Rebecca, for your great advice. Okay, so here is a question that I will take. So is the Global Health Department at YSPH the primary department that works with refugee health? So it's very important to mention, and I forgot to do that. Thank you for the question. Global Health concentration is not a department. It's a concentration, and it works with all departments. And the reason we're not a department is because it just didn't make sense anymore for Yale to have what was used to be called a Global Health Division, because each department is doing global health. So it's working like a charm in the sense that we connect with all the departments. And I would say that for refugee health, the key person to contact is Professor Kaveh Kushnut, who would be able to tell you exactly with names and last name who is doing refugee health in which department. And Kaveh happens to be the representative of EMD in the faculty advisory committee of the global health concentration. But there are other departments, maybe social and behavioral sciences, that are doing work with IRIS, the Refugee Resettlement Agency in New Haven, and so on. So we do want Julie to share with all of them the names of the faculty who are the representatives in the Global Health Concentration Governance Unit for each department, so that they can contact them as well.
Okay.
That will be great. Okay, so, and then there are questions about Middle East, North Africa. So Kaveh Kushnut, speaking about Kaveh, has very, very strong partnerships in Lebanon. And he's done a ton of work with, among others, is the American, AUB, American University in Beirut. And the researchers there do a lot of work with the refugees from Iraq and from Syria that now live in Lebanon, in Beirut, in many of them. So yes, we do have some connections. I'm trying to think about other Middle East countries, and Lebanon is the one that raises to the top, and we do have a very good link with AUB in Beirut. So I think for West Africa, so yes, and the Caribbean, yes. So we do have links. I work a lot, for example, with the University of Ghana, and we've had a very long standing relationship with them. And there are faculty members in our school or in the School of Medicine that we work very closely, that work with universities in many, many different parts of Africa, West Africa, East Africa, and South Africa as well. Okay, so I guess, this is the end of the presentation. If you have any questions, please email Julie, and she will bring me into any question or any matter that for which my input is required. But she knows Upside Down. She has been one of the key architects of the current structure of the concentration. So I think Julie will be able to either answer your questions directly or to triage your questions to the right person.
Absolutely. I'm going to be happy to talk with more of you. I have set office hours, so I definitely have time in my schedule.
Yeah, so let me stop sharing. Okay, so are there any remaining questions?
No, do we have any hands raised? I never know how to find the hands.
No, I think not.
I don't see any others.
Okay.
So I want to thank you both so much for taking the time to share more about the concentration in global health. For all of our attendees, I really hope this was helpful. Like we've all said, if you have questions, feel free to reach out. And we hope to see you at other open house events throughout the next few weeks.
Thank you so
Thanks,
much,
everyone.
Becca and Julie. Thank you, everyone. Best wishes.